Good evening, everyone. How are you all? We're still waiting for other students to join, so we'll be starting the class just in a few minutes. So please wait and we'll start soon. Thank you. All right, I think most of the candidates who are supposed to be here are already here. We can start our tonight's session. So I'm Dr. Arshan Ahmed. I am I am going to be your main mentor for the AMC MCQ preparation. And I'm sure many of you know about first aid, and most of you heard about first aid from your colleagues, your friends, maybe someone who just recently passed the exam, or you have been scrolling our Facebook group for a while, and you have seen a lot of students passing the exam in their first attempt. So that is usually almost everyone's story. Some of you might be already doing a course and you want to know how this course is going to help you. There are few of you who might have appeared the exam and unfortunately you failed the exam and you need some specific guideline to pass this exam. So every one of you have a different kind of a story, but as a summary, this is how it is. So you're here to pass your AMC MCQ exam. And first aid has the highest number of AMC MCQ and clinical students passing in the real exam every month. And it's not just that we say it, you can always have a look at our Facebook group, how many students are passing the exam. So the encouraging thing about it is that AMC MCQ is not an impossible exam to pass. The pass rate is quite high, 60-70% passing rate. Unfortunately, AMC Clinical doesn't have a very good passing rate. And that is understandable because it is the last exam and any kind of final exam are always difficult. But you're not for that. You're here for AMC MCQ, the first part of being a doctor in Australia. So let me welcome all of you in our First Aid AMC MCQ course, and I'm sure you're going to love it. I am one of the doctor who is working in Australia at the moment, and you'll have few other mentors who are also going to be the part of your preparation. All of our mentors are working in Australia at the moment, and many of them are registered, many of them are just passed the MC clinical and started working in Australia. So among all of them, I am the most senior one, and I have been working in Australia for the last 10 years. So I've got a huge experience of how Australian health system works. I know each and every update that can possibly come in Australian health system because we are currently practicing and we need to be updated to keep on practicing here. So the first and foremost thing about AMC MCQ is knowing what is AMC MCQ. And even some of you are here who doesn't even know what is AMC. And we get a lot of questions like that. But we're here to guide you throughout this class tonight to understand what this MCQ exam means. Tonight is not about any subject. We used to discuss psychiatry during the first trial class. Even last batch we did that. But this time, I have changed a little bit with the first trial class, how I want to take it. So tonight is about understanding AMC MCQ in detail and dissecting this in a way so that you know each and everything about it and you can start your preparation from tonight. Okay? So this is an introduction session about one, that how first aid is going to help you with passing this exam, and second, that what is AMC MCQ exam, how the exam is conducted, what are the important tips and tricks, what are the researches that you need to follow, and why a candidate can fail this exam. Okay, so let's start. Now, we keep you muted throughout the session, but if you need to ask any questions, you can always write it on the chat box. And at the end of the class, you can also unmute yourself and ask questions directly. But please keep yourself muted during the class so that we can have a nice, smooth session. Okay? So, first of all, I want you to have some hope because you are here to pass the exam. And having a proper guideline in front of you is really important. Many students waste a lot of time, waste a lot of money with lots of different courses, buying materials from scammers all of the social media. So I hear a lot of stories, and sometimes it is a bit sad that candidates are wasting so many times where we have a course which is structured in a way that candidates are passing exam every month, and this is the course which has made it possible that nowadays almost everyone who goes into exam from this course pass the exam. So we have made sure the structure of the course is in that way so that you don't fail this exam if you're well prepared. Now, we also get students who just do our class for a couple of months, not fully prepared at all, and go for exam just to know how the exam works. Now, that is not our problem. That's your problem if you want to do that. If you want to just see how the exam works and fail the exam, that is not a blame we are going to take. But if you are well prepared, if you finish everything that we have done, you will pass this exam. Okay? As you can see that this is just a list of our last year November exam past candidates. And we could not even write everyone's name in one page. So this is just a single page, but if we need to write all the students, it will be 3 more pages. So we don't normally give the counting or number because like it's not a good idea to say the numbers, but we get a lot of students who pass the exam. And that's why you will hear about first aid everywhere. So, and this was our, like not the last year, the year before, 2024, the same thing. Even the exam result that just been published, the I guess, the April exam, we have got 40 students who passed the exam. And among the 40 students, 35 of them are first-time attempt candidate. Few of them did different course and then joined our course and they passed the exam. Among them, there are, if I'm not wrong, 12 or 15 students who are running batch students, which means that they did not even need to finish the full course and they prepared with us for 3 or 4 months and they appeared the exam and passed the exam. Now you can ask me that how that is possible. The reason is that we also provide the last batch class recordings as part of your enrollment. So any of you, when you make your full payment, you get access to our recently finished batch, which means that someone who has a lot of time and doesn't have a lot of time for the exam preparation. Let's say that you have already registered for your exam in 3 months' time. You don't have 5 months to finish this course. Then there is someone who can get help from this last batch recorded session. So this is not for everyone. We don't say that please just go through the recorded session and finish the course, because it is not how we recommend it. But if someone doesn't have time, especially we get a lot of students who wants to enroll the course just to go through the recorded version and finish the important topics from us. And we have seen that candidates pass the exam in that way. Just this month, 10, I believe 12 to 15 students were like that, who went through the course, enrolled the recent batch, which was the January batch, and they passed the exam in their first attempt. If you see our student marks in the exam, our students' mark goes above 300. And remember one thing, that getting 300 in AMC MCQ is not super common. Most of the candidates who pass will be between 250 to 280. That's usually the common pass mark. But our students, when we see their marking, we see that it's more, many of them go above 300. And that also means that the course is having that standard so that the students can pass in a very high mark as well. I know you have a lot of questions in your mind, and tonight's session is about those questions. So we'll answer each and every question that you have in your mind. So don't worry. Let me finish what I want to discuss with you, and then we'll have a good discussions. Okay? So before we go into AMC MCQ, what it means, what does it involve, I want to go through the course a little bit, and then we will go into AMC MCQ, and then again we'll come back to the course. So this is the trial class that you have joined today. Our classes are always at 7:30 p.m. Sydney time. And classes are usually 2 to 2.5 hours duration, so 7:30 to 9:30, or sometimes it can go to 10. The new course, which is the June batch, is going to start from 9th of June. And from 9th of June, the initial 2 weeks are going to be free classes for everyone. So whether you join the course or not, every batch we allow this 2-week session so that you understand how we take session. We don't ask you to believe us from someone else's word or believe that this is the right course for you to join from someone's feedback. We want you to take this 2 weeks free session and then decide whether this is helpful for you or not. If you feel that, yes, this is helpful for me, I'm getting important information which I was not getting somewhere else, and it has a structure that I'm willing to follow, that is the time you join the course. There is no platform in Australia or any other countries who are preparing for AMC MCQ who allows 2 weeks free sessions. We are the only one who do that. And because we want to be black and white, we don't have anything to hide. We want everyone to join this session and understand that yes, this course is something that I like. I'm satisfied with how this course is going to look like. So yes, I want to join the course. So these 2 weeks free sessions are very, very important. Those are part of our full course. And any of you can join these sessions to get some ideas. Okay. So that's the schedule of that 2 weeks free session will be given on the Facebook group. The course details. This is a summary of the course details. Our course is a 5 months course. Why we make it 5 months? That we believe that no one can pass AMC MCQ with 2 to 3 months preparation only. Because initial 2 months, so I divide the AMC preparation like this. So a student who first thinks that I want to pass AMC MCQ because I want to be a doctor in Australia, from that thought, so you've got a thought in your mind that's going to change your life. And from that thought, you start searching things, you start talking to people around you who has passed the exam, who has some kind of ideas. That takes, let's say, few months, so 1 to 2 months. And then you start becoming more focused. You learn that people do few courses, there are lots of groups, there are Q banks, so you get some more ideas about this exam. And then you learn about a course and you start enrolling into that course. That even though every course is well structured, some courses are not, but most of the course should be well structured. So you do, let's say we talk about our course, you do start our course. The first 2 months are the learning phase. This learning phase, you will still become more and more oriented to the exam questions. You will still be a bit confused. You will feel like, I don't know what I'm doing. I don't know what's going to happen. I'm sure I'm going to fail this exam. So you will be in a depressive phase, which is basically the learning phase. The experience, you gather experience month by month and you start becoming a pro. The last 3 months of the course, you become an active participator. Now, this active phase is your main phase of your exam preparation. In the active phase, you know everything, that yes, this is the important thing I need to read. I know the guideline. I know from where these topics I need to read. So you know everything. That is the time you start your main preparation. The initial 2 months, the learning time, it is going to be a bit confusing, overwhelming for everyone. So that's how it's going to be. That's why we make sure that you at least have 5 months with us so that we can support you during these phases. A course that's finished within 2 months cannot even finish the learning phase. So how they can help you during the active phase of your learning. So that is what we feel, and that's one of the reasons why the course is extended to 5 months. And if you can finish everything that we are discussing in the 5 months time, you can appear the exam in 6 to 7 months. Okay, so I always advise to keep 1 month for revision if you can. If you don't have that time, like let's say the June batch that we are starting, it's going to be finished in October. So if you are going for exam in October or November, which I advise you do if you can, if you have time, in that case, what will be your preparation with us is that you finish everything that we are doing in the live session, but also do some of the past recordings as well, so that you can finish your preparation before your exam. Okay? Because the theory doesn't change a lot. Theory remains mostly the same. It is the recall or question solve that you need to get updated. So if your exam is in October or November this year, then yes, it is still fine. Please do not get scared that, well, the course is going to finish in October. How am I going to appear the exam in October or November? We have a lot of students who do that and who have done that last year, the year before. The exam past student picture that you have seen here, most of them are like that, who joined our June batch and then they appeared in October or November and they passed the exam. Because the recorded sessions that we have from the past batch help them to finish the learning even sometimes within 2 to 3 months. So that is one of the possible options that you have. And if your exam is going to be next year, February, then you have a lot of time in your hand anyway. So you will be mainly focusing on appearing the exam in October, November, or next year, February, March. That should be in your mind. Okay? That's the maximum I want you to go. Every one of you should appear your exam by April next year. Now, let's talk about the course structure. And then we'll dissect AMC MCQ one by one. So before we go into that, you need a little bit of an idea that what is AMC MCQ. So let me go into that for a while, and then we can come back to this. So AMC MCQ exam is a 150 question multiple choice question, basically MCQ. So when you think about being a doctor in Australia, these are the two exams that you need to pass. Part 1 is MCQ, part 2 is clinical. AMC MCQ is reasonably easier than clinical, as you might have understood by now. It has a 150 question and you get 3.5 hours to finish 150 question. It is a computer adaptive software-based exam, meaning that there is not a single exam paper. The AMC has thousands of questions in their bank or software, and the software is going to give you questions randomly. So you get random question from that thousands of questions AMC has got in their bank. That's why it is called computer adaptive software-based exam, which also means that none of your questions are going to be same in the exam. You might be in an exam room where there are 30 students, and each of you will be in front of a computer in the exam center, right? Every one of your exam question will be different from each other. So none of the questions are going to be similar. So if you think that my number one question and this next person who might be sitting very near to you in the exam, I can see that she has ticked option C in the question number 1. So I'm going to also take the option C in my exam. You will be wrong. And that's for 100% sure that you will be wrong. So there is no way each of your exam questions will be similar in exam. Okay, so please do not do that. So what happens in AMC MCQ exam? First of all, you need to apply for a AMC candidate number. So that is called having an Epic account, right? Nowadays, it's what we call Intel Health. So you go into the AMC portal. Now, in our course, we will help you with all this Epic account and everything. So please don't worry. So first you create an Epic account where you will be giving your all the informations, and they will ask you to upload your MBBS certificate documents. And then you'll be verifying this MBBS certificate or any other relevant documents through online notary cam. Once your MBBS certificate is verified through the EPIC portal, you will get your AMC candidate number. Without having this candidate number, you cannot appear the Part 1 exam. So once your AMC candidate number is available, you will be able to register for the exam. And where to register for the exam? The portal is amc.org.au. So in amc.org.au, this is where you'll be able to register your exam. Exam happens every month. So there is a lot of seats for AMC MCQ. So please do not worry about getting an exam date. Everyone gets exam date for AMC MCQ. So every month there will be exams and lots of dates are there. And you can also see the dates of the exam for each month in this website. So once you're ready, you go into the website and you register for the exam for a specific date. There's a lot of myth about this, that when I should register for the exam. Now, remember, there is no specific guideline or choice. You can appear any month, any date. People say that do not go for exam in February, do not go for exam in June, because the exam is difficult in those months. It is not true. We get a lot of February past students in our course. We get a lot of June past student in the course. And no one told me ever that this exam is very difficult. Exam can be difficult in any date or any month based on your preparation. If your preparation is not good, every month your exam is going to be difficult. Okay, so please do not listen to this. Now you can ask me that, well, is it better to book a date a bit later in a month? Yes, it is a bit better because, yes, sometimes you can solve some questions in the early week of the exam, and that is important. So, yes, if you ask me that should I book the exam a bit later in that month, yes, do that. That is not a bad idea. But as a month-wise, you can book at any month you want. It's not a problem. So once you get a date, you also need to know that whether your country has got AMC exam center, because many countries will not have AMC exam center. So for that, let's say Australia definitely has got a center. We know that India has got a center. Pakistan, I'm not quite sure if the center is open yet. I heard last time that there is a center that has opened. So Pakistan might have one. So India, Pakistan, Thailand. Then very commonly people also go to Singapore and China. So these are the most common countries where there are exam centers, and you can always search in AMC website for any of your country's center if it is available there. Now, if you are not from any of these country, then you need a visitor visa to a nearby country where you can go and appear this exam. So that's also important preparation, because you can't just start preparing for all of this a month before your exam. You need to start preparing for all of this at least 3 to 5 months before your exam, because it takes time to get a visa. It also takes time to do all of those. And month before your exam, you need every minute of that month to prepare. You don't want to waste your time with visa document preparation and everything else. So let's say you are going for an exam in the center. In the center, when you go there, you'll need to show two documents for your ID verification. One could be your passport. So if you don't have passport, please make one, because that's the number one verification ID. Everyone should have it. Then it could be your driver license. It could be your bank card, but the bank card, not just any bank card, the bank card should have your name or signature on the back. Because you can bring anyone's card. That's not a verification. So your name should be there, and also your signature should be there on the bank card. Without your name on the bank card, it is not a verification document. So let's say your ID was verified by the AMC center. Then you are taken into the exam room, and in the exam room you'll see a lot of chair and table. On the table there will be computers, and you'll be sitting on the specific computers, and you will start your exam. Now there is a few things in between. We'll show you that in a minute. Not in a minute, in 10 to 20 minutes. But before that, let's talk about how the exam gonna be. So it's a multiple choice question. Each question are, so this is the question, and you get A, B, C, D, 5 options. Out of 5 options, only one will be your answer in the exam. And you always take the best option, not just correct option, the best option. In exam, there might be 2 or 3 answers which might be correct for that question. But you need to choose the best option out of those. Okay? There is no negative mark for this exam. So if you get wrong in any question, that's not going to cause any trouble. Of course, it's gonna cause problem. If most of the questions are wrong, you'll fail the exam, but you will not get a negative mark for wrong answer. So how we divide these 150 questions, 3.5 hours. So 150 questions, out of 150 questions, 120 questions are scored questions, and 30 questions are pilot questions, or they don't have any score. But you don't know which one is pilot and which one is scored. But you know the last 20 questions are always scored questions. So the last 20 questions always carry high marks in exam. So please make sure that you have enough time in your hand for these last 20 questions. And they're never pilot questions. Out of these 150 questions, so 150 questions has 500 mark in the exam. Okay? And when you get the AMC exam mark sheet, it will look like this. So your mark will be range from 0 to 500. Out of 500, if you get 250, you pass this exam. Even if you get 249, you will fail this exam. And unfortunately, we see some of students who fail with 249. Now, you might be thinking how they mark 150 questions 500. We don't know. No one knows. Because the exam questions will not have any mark on there. So you'll not be able to know which question carries what marks. So your first question might carry 1 mark, and your fifth question might carry even 10 marks. You don't know. Okay? So how the software is designed in this way, how much mark will be there for each question, there is no way to know that. So every question is equally important to you. Now, what happens? It's a computer adaptive question. The computer adaptive question means that it adapts based on your answer. So one candidate, the first question will be usually an easy question, and the mark will be likely to be just 1 mark. The candidate got it right. The second question will be slightly difficult than the first question. Maybe the mark is 2. Candidate also got that right. Third question will become a bit more difficult. So until the candidate gets wrong answer, every question will become more and more difficult until one question answer is wrong, and then the software repeats this again. So your question in the exam will be a combination of easy and hard question. So that's why sometimes we see that people who say that my exam was very difficult, I got a lot of hard questions, I have never seen these questions even with question solves. Those are the candidates we see pass the exam very easily. So if your questions are hard in the exam, means that you are doing really good. So please do not get scared if your questions are difficult. And people who say my question was really good, it was very easy, I'm going to pass this exam. And unfortunately, that is the candidate who fail most of the time. Okay? So that is how the computer adaptive exam works. So you need only 250 mark. I don't want you to get 300. You don't need to prepare for that, but prepare for at least 250 and pass this exam and be done with it. So if you have 3.5 hours for 150 questions, so you have basically 210 minutes. So if we divide 210 minutes for 150 questions, each question gets 1.4 minutes, which means 1 minute 24 seconds per question. Now, this 24 seconds, do not even think that you will take 1 minute 24 seconds for each question. Your thinking should be that every minute I'm going to finish one question. That's your thinking, because there will be some questions where you will take 2 to 3 minutes, because the questions might be very long question might be difficult question, so you will be taking more time for some hard questions. So you need to save some time when you get some easy questions. So easy question, you'll be taking even 15 to 30 seconds and save time in there, so that for hard questions, you can have that time to think. And sometimes even questions can be, the whole page can be the question. So even to read the question, it takes 1 minute. And that happens. Not every questions. There are going to be at least 20 to 25 questions which will be like very big questions. So for those questions, you need time. So you don't have a lot of time for each question, as you can understand. So there is no way that you will just sit and think for a long time for every questions, because the chance is that you will not be able to finish your exam. Unfortunately, if you don't finish your exam, the result might come as withhold. And withhold means you are actually failing that exam. Okay, so you have to finish your exam in every way. I will come in detail about the AMC exam, how the questions usually works and everything. So I'll come into that just after a few minutes. If you look over here, that this is the subjects that AMC exam the questions are coming from these subjects or topics. According to AMC guideline, medicine gets 30% question, surgery 20%, and 12.5% questions comes from gynae obstetrics, pediatrics, psychiatry, and biomedical or statistics. Although AMC, the software does not follow this every time. We see a lot of times when a candidate can get 25% questions from psychiatry, who are the unfortunate ones, because psychiatry questions are difficult, psychiatry questions are bigger. So that it can happen. It doesn't follow this pattern always. There are candidates who get 50% questions from medicine. So it always changes. There is no specific pattern. So every subject is equally important for you. Now, one thing I wanted to discuss before we go into the course discussion is how exam questions works. So we were talking about 1 questions, 5 options, and 1 best answer, right? Let's go into this guideline. So this is a guideline from Australia. They don't give you a lot of guidelines, but fortunately they have given this guideline. So this is a guideline where you can learn about exam in detail. So that's from Australian Medical Council, who has given a exam specifications. So let's have a look. So we know already that it's 150 questions, and we call it type A questions. Type A questions means there is only 1 correct response from 5 options. We already know it's 120 questions are scored questions and 30 questions are pilot, and you get 3.5 hours to finish these 150 questions. We talked about the ID requirements to appear the exam. Sitting in the exam room, so that's fine. Right board. Every one of you will be given a pen and a right board where you will be able to write things if you want. Sometimes you might need to do a small maths in the exam for a stat, so you will be able to write it on this board using the pen. You cannot take any other belongings in the exam. Okay, so everything will be given in the exam room. If you need to take a break for washroom, you can, but your time will continue. So please make sure that if you can, empty your bladder before your exam and do not go to washroom during the exam, because you don't have that luxury of time, because time is essence in this exam. So when you sit down in the exam room, you'll see this following screen on the computer. So your name will be there, and they will also write, please do not touch the keyboard until advised. So just because you are sitting on a computer, do not start using the keyboard and start the exam. So they will advise you that, so everyone will sit first, and then the invigilator is going to say that yes, you can start your exam, or you can touch your keyboard, then you begin. So do not touch the keyboard before they advise you, because the proctor is going to give a bit of a briefing before you do that. And then they will give you some non-disclosure agreement, and definitely every one of you will need to agree with that. After that, you will be given 5 minutes to read some of the things. So that's fine. If you do not agree to the disclosure agreement, you will not be able to appear the exam. The second screen, once you agree to the agreement, second screen, they will give you a tutorial, like a practice question. Remember, this practice question does not carry any mark. So you can just choose anything you like. But there is some learning in here. This practice question, you can see that this is how a question is going to look like. These are the options. And on the right upper border, or on the top right, you can see the timer. So this is where your exam timing will also appear. And it will start from 210 minutes and then it will go backward. So in here, you will need to select one answer and then you have to click this next button. See that this is how the exam is going to be as well. So you get one question like this and you choose the right answer and then you click on the next button. Then it will allow you to go to the next screen. Remember one thing, that if you do not, let's say you don't know anything about a particular question and you don't want to choose anything, can you do that? Can you go to the next button and come back later on if you have some time? No. AMC, the software has been changed over the last few years. They do not allow you to come back. Once you go to the next page, you will not be allowed to come to the previous page anymore to change the answer. So you can't change the answer once you move on to the next question. Very important. Previously, people could flag their questions. Let's say that I don't know anything about this question. I will flag this question and I will come back after finishing everything to change my question's answer. Can you do that anymore? No. So you can't do flag anymore and you can't come back to any questions after your exam is done. So once you choose an answer, software will take it as your only answer. Now you can ask me that if I am in this page and I have chosen option C, but then immediately I think, no, I don't want to choose the option C. I want to choose B. Can I do that? Yes. You can change your answer as long as you are on this page. But let's say I clicked next button and the next question has come, then there is no other way. That answer that you have ticked, it is your answer and software has already taken that answer. I hope it makes sense to everyone. After that, they will give you a practice question 2. Same thing, you will choose an answer and go to the next button. After the next button, 4th screen will be your exam information screen. So they will write you have 3.5 hours to answer all the questions. You should attempt to answer all the questions. You must make a selection before moving to the next question. Then you click on the next button. Then they will say, are you ready to begin your exam? If you click yes, your exam will be open. Okay? Few other things are written in here. You have to choose one answer to go to the next page. Without choosing one answer, you can't go to the next page. Okay? That's one of the important things. Sometimes a question can be really big that it's not fitting in one screen. If that is the case, you will see there is a scroll button on the side. If the scroll button is there, then if you see that the question is not full, if you just remove the scroll button, you will be able to see all of the questions. Okay? One of the most important thing, once you finish your 150 question, you can finish your examination by clicking on the end exam button. So there will be an end exam button. See this end exam button? So you need to click on the end exam button to finish your exam. Let's say that you have finished 150 question and then you did not click on the end exam, your exam will not be marked. Your result will come as withhold or even fail. So please make sure that you do not forget this with the exam pressure. Once you have done that, you should raise your hand and the proctor will come and check everything, and that's the end of your exam. The following message will appear if the session time limit has been reached before you complete all questions in the exam. So once your time is up, this will come up. So your time has expired. Click OK to continue. Okay? So make sure that you click OK to continue at least. So that's basically how the exam is going to be. Did you guys get a basic idea about like the questions pattern and also like the logistics of the exam? Because that is the first thing you need to know. And our portal, the student portal that you will get access once you enroll the course, the student portal will have a lot of mock tests like this, and you will be well prepared for this kind of questions or exam. Okay, so let's talk about the course a little bit, and then we come again to AMC MCQ preparation. So if you cannot finish every question, which is 150 question within the given time, you will fail the exam. So even though if you would pass the exam, the AMC software is designed in this way that you have to finish all 150 questions to get even the mark in the exam. So if you find out that definitely you will not be able to finish your exam in time, please make sure that you choose any answer in the exam. Let's say you have 1 minute to finish 10 questions. Just choose randomly and at least finish your exam and click on end exam. Because if you don't, your exam result is going to be failed. So very, very important. And this is a common mistake people do a lot. So you make sure that if you are going to run out of time, you still will have a chance to pass the exam if you at least finish every questions. Okay, but if you don't and you get a message on your screen that your time has expired, that's the time you will get fail. Okay, let's talk about first aid AMC course and how it's going to help you to achieve this AMC MCQ in your first attempt. Remember, almost every student who goes in the exam with first aid AMC preparation, they pass their exam in the first attempt. So first of all, this is a 5 months course. We divide the course into theory plus question solve. Question solve has got a lot of name, recall, random questions, so many names, but it's the same thing. So we call this as question solve. So we do theory and we will be doing a question solve together. Please keep yourself muted. So 5 months course is divided into theory and question solve discussion. We get 2 class on theory and 1 to 2 class on question solve every week. So you get 3 to 4 class per week for the 5 months to finish your MCQ preparation with us. That is a huge amount of classes that we take. And these are important. Without taking these classes, you will not be able to pass this exam, because we make sure that we take enough time to share all the important information to pass this exam. So 3 to 4 classes. Most of the classes that we take, the classes will be, so we know that the time is always going to be the same, 7:30 to 9:30 p.m. Sydney time, just like tonight. The class days are mostly we will take class on Tuesday, Friday, that's fixed class. And based on the question solve classes, question solves usually that happens on Saturday and Thursday. So that's usually the case structures. So Tuesday, Friday, Saturday is mostly fixed. Thursday, based on if we take the session or not for the question solve. But nowadays, at most of the time, we see that we need to take 4 classes in a week. So, number of live classes. So courses designed are, when you go into our student portal, the student portal is divided in such a meticulous way that it is super easy for anyone to navigate through the portal materials and get everything in a very structured way. If you have heard about first aid, you must have heard about these structures that we have made, and this is a new portal that we have been using since last year. And we made sure that, because definitely the first year was a learning phase for the website as well, and every website in their birth year, so basically that is the birth year for that portal, every portal in the birth year struggles because we always get bugs, we always get a little bit of things that we need to change, and that happened in the last year as well. But when we started this new year course, so this batch, you will not hear any issues about the portal. The bugs has been fixed, the portal videos are working perfect, everything is now in the perfect phase. So yes, initially when we started the portal for the first time, because the previous portal that we used, it was becoming a bit old portal, but now the new portal is super fast, super easy and structured, and it is very much well oriented with the recent exam format. So the portal is very well structured. So when you get access to the portal, you will find out how easy it is and how easy it is to find everything there. So we take live sessions for the entirety of the course. We do not just ask you to go into the recorded version of the class. Many courses do that, but we don't do recorded class only. Almost 95% classes will be live classes. Yes, we have recorded classes, but those are past batch recorded classes. Those are like addition or extra bonus for you. No course in Australia offer past batch recordings, because to keep this thousands of storage in our software to allow you to give these past batch recordings, it cost us a huge amount to even give this to our students. But we do that because it helps our student to go through those past batch recordings to get some ideas about the portal and utilize their time in a way that they can pass exam just after the course is ending. So the number of live classes that we are going to take in your batch is theory, mostly 35 to 40 classes. Question solve classes will be 40 to 45 classes. But I usually keep the lowest one. I don't give you the maximum one. I give you the minimum one. And if we take something extra, that will be bonus for you. but this is minimum, and that's always going to happen. So you get 35 classes on theory, 40 classes on question solve, and that is more than enough to finish every topic that can ever come in your exam. How we do this? So this is our live class, and you also get recorded session, which is the past batch that we just finished. This past batch recorded class help students who are short of time. So we have past batch theory classes, which is 35 sessions, and past batch question solve class. This is our extensive collection of questions. We have at the moment 400 class, which we have taken in the last 5 years. So last 5 years, all the question solve classes we have taken, which counts like nowadays I can't even count them. So it's almost 400 classes that we have taken, covering the last 5 years questions is going to be in your portal. But you might ask me that, do I really need to go into all of this? No. So please do not get scared, because for any candidate, my advice is that you finish all our theory classes, because that's your basic, that's going to build your strength knowledge. But you also do at least the last 1 year questions. So if you at least, so in the batch, you get the monthly question solve classes, and then you just cover the last 6-month questions that we have taken in the last batch. So together, that will be 12 months question. With that 12 months question and the theory knowledge, anyone can pass the exam. Okay? But we have got this as part of a bonus for any students who enroll into the course. If you have time, you can always go back and learn a bit more about the question pattern. Remember, this number of classes, the questions that we have is more than any Q bank that you will ever see in Australia. So we have got a lot of collections. Theory class. So how we take our theory sessions? Theory classes. Theory means we divide the theory into each subjects that exam comes from. So medicine, surgery, pediatrics, gynae obstetrics, those are our theory class. In medicine, which has the biggest percentage of questions, we will cover all the topics. So cardio, respiratory, GIT system. So cardio, we have 3 class, respiratory 2 class, GIT 2 class, neuro 1 plus basically 1.5 class, hematology 1 class, genetic urinary 1 class, endocrine 1.5 class, dermatology 1, infectious 1, and emergency medicine 1. So these are our medicine topics. You can understand that so many topics are there to cover, and we make sure we take enough sessions to cover these topics. And we focus on these guidelines. So the guidelines that you are supposed to follow for medicine is John Murtagh 9th edition. So 9th edition is the current edition, and you will get access to all soft copy of these guidelines. So all the guidelines and books, the soft copy will be provided in your course. So you don't really need to buy anything. We also focus on a lot from ETG or therapeutic guidelines. RSCGP or AGGP, this is one of the guidelines that we follow for medicine-related questions. For screening questions, so exam has a lot of screening questions like bowel cancer screening, breast cancer screening, prostate cancer screening. Those cancer screening we read from Red Book. Currently, that is the 10th edition that we will follow. And definitely First Aid AMC lecture note will have almost everything from all these topics. So you really don't need to read this by yourself. You don't need to read John Murtagh page by page, because the course is going to combine every topics in our lecture note, and that will be more than enough to pass the exam. So you don't need to read all of this by yourself, because these are the guidelines we are going to follow to make a note, and that note will be super important, and it will have a combination of all the necessary guidelines to pass this exam. And then we say that once you finish a topic or let's say you finished medicine cardiology, go to any Q bank and solve some questions from there. Nowadays, we advise everyone to go to the e-medicine question bank, because that's the recently updated Q bank. The other Q banks like Amedex, M+X, those are no longer needed for exam preparation. E-medicine will be more than enough if you really want to go to any Q bank. We are also arranging some important information from e-medicine. So the questions, discussions in the e-medicine, we are going to incorporate in a way that you get the gist of those questions and answer, and you'll be given that as part of the course enrollment. So you don't really need to go and buy the e-medicine anymore. So the course will discuss those questions anyway with proper answers. Surgery. Surgery, we have trauma. That's the main surgery topic that we will discuss in the course. General surgery, and then we also will have class on eye and ENT and orthopedics. The guidelines we follow for surgery is John Murtagh, Kaplan Step 2 CK, Trauma Victoria Guideline, Emergency Australia Guideline, and again, our lecture note will have everything that you need. Pediatrics has a lot of topics. After medicine, pediatrics is the next most vast topic that you will need to go through for this exam. It has a lot of topics to cover, and you can see all the necessary topics we are going to discuss. Main is John Murtagh, but a very important guideline for pediatrics is RCH. Just like RSCGP in medicine, RCH is a very important guideline for pediatrics that everyone should follow. Apart from that, we'll also take help from Kaplan Step 2 CK. Again, the lecture note will have a combination from all of these guidelines, and that will be enough for your preparation. Psychiatry. Main, John Murtagh doesn't have a lot of psychiatric topic. It has few topics like anxiety disorder. It has behavioral disorder. So some topics are there, but mostly we will follow Kaplan Step 2 CK for psychiatry guideline. And then there is a kind of a Q bank for psychiatry, which is called U-World USMLE, which is very good for having a basic on psychiatry. Psychiatry is quite difficult, and it is one of the most difficult topic that you will read for AMC MCQ. But with our discussion, with our guidelines, and with this U-World USMLE, it's going to be really easy for you. So please don't get scared. You will have a very, very good basic after our class. Gynae and obstetrics, we will follow John Murtagh, Kaplan Step 2 CK, but these guidelines are quite extensive. Like for obstetrics, SA Health is very, very good guideline. So we follow a lot of SA Health guideline for obstetrics related questions. And then there is RANCHCOG, RSCGP, has few topics. And we also incorporate every details into our lectures, which will be also more than enough. Okay? And others. We also need to cover a stat and ethics. So ethics, we will take a session as well to get some understanding. There are also some extra classes that we take on ECG. You'll have classes on medical imaging, so chest X-ray, CT scan, which comes in exam. You'll have classes on cardiotocography, arterial blood gas analysis. You'll have classes on emergency related topics like snake bite, then some spider bite, lots of insect bite. So those emergency related topics. So those will be our extra sessions as well. Okay. So basically that's how the theory discussions are going to be. Once we do a theory class. Let's say we finished full cardiology. After that, we will do a theory-based question solve class, which means we will take all the last 1 to 2 years important questions from cardiology and make it into a single class, and we will solve it together so that you understand how your theory knowledge is helping to solve these MCQs. So you get a good idea about what you have learned. And then you can go into the student portal and appear theory-based mock exam, meaning that let's say you finished cardiology, everything is done, then you go to the student portal, and in student portal you can appear cardiology mock exam. Currently, we have 40 theory-based mock exam on the student portal, which is a lot, and you can appear unlimited times. So with those mock exams, you get an idea about your preparation, you can also get to know about the right answer, their explanation is going to be there. So that's a pretty good amount of mock test only on theory. Then, so that's only about the theory classes we just talked about. Next, we have recent question solve class. As a whole, you get 40 to 45 recent question solve class in the class. So there will be other mentors who you will meet during this free 2-week session, some of them. And those mentors are going to take these question solve classes. We make sure that we do this monthly question solve. Every month we will be doing question solves. We will solve questions for you. You will get an understanding about the exam pattern, how the questions might appear in the exam, what are the important topics for the exam. So that's gonna be covered. With that, every month we also add monthly question-based mock exam. Currently, on the student portal, we have 80 monthly mock exam, which also gets, like every month we add more and more. So there will be more in your batch. And currently we also have full mock exam, so which is the grand mock test, which means it has 150 question, exactly same like exam. Currently we have 5. Okay. So that's a lot of mock exam to get an idea about your preparation and also have that understanding of how you are losing time, how to manage time in the exam. Okay. And because every one of those mock exam on the portal are time-based. Now, very exciting for a lot of you. Many of you keep on asking these questions to us that do you do exam week question solve classes? We know we did not do that before, but nowadays from your course, this has just been added, but there will be some very minimal added fee for that because it takes a lot of time and effort to take something like this. But that will be an extra subscription, but very minimal when you are, and this will be only available for the student of the course. But that's what gonna help a lot of our students. Recording. A lot of students cannot join the live classes because Australian time sometimes can get a bit trouble with your overseas time and you might be working in your country during the class. But we can't change our class time because this is our night time and every one of us work here. So only time we can take live session is the evening time. So if you miss any live classes, there will be recording, which is a video recording of the class. And these recordings are not gonna vanish within a day. You will see a lot of course where they provide recording, but only for 48 hours or 24 hours. And then they will delete that recording. And you will be in a lot of mental pressure. You will be in a lot of hurry that, let's say, anything can happen. You might be sick. You might have some kind of program. And so it's very, because right now you are not like a school student that we need to keep recording only for 2 days. So you have to be a responsible person as well. But I don't see any point of deleting a recording after 1 or 2 days because it's not help, it's not actually helping anyone. So there will be courses like that where you will not get an extended recording. Please make sure that if you hear about any course, you know about these tiny little details because they will not tell you until you enroll into the course. And then you will come back to us and saying that this was a mistake. I I did not know about this and I already lost a lot of money. So those kind of things we hear a lot from a lot of students. So recordings are important because then there will be time when you will not be able to remember everything that we discussed 2 months ago and you need to revise. And these recordings, if you have been reading our past student feedback, you will see that some of the students go through this recording 7 to 8 times, and it helps them. You can just open your device while you are on a train, and you can just listen to what we are saying, and it helps a lot. So these recorded classes are going to last throughout your course subscription. So if you subscribe, so we have two subscription options, 10 months and 15 months. If you subscribe for 10 months, it will stay there for 10 months. If you subscribe for 15 months, it will stay for 15 months. Okay. First Aid AMC is also a accredited CPD providers under Australian Medical Council. So under Australian Medical Association. So according to AMA, we are eligible and accredited to provide CPD to you through the course or classes. Now, any CPD providers in Australia, if they give you CPD certificate, they will charge you more than $500. But our course, the most affordable course is at the moment $599 Australian dollar. So to provide extra CPD certificate, there are some options if you go into the course fee. So if you go into our First Aid AMC, the details in here, which I should show you so that it can become easy on you. Let me just show you from the first so that it's easy. So if you go to firstaidamc.com.au, that's what's going to look like. Remember, we have an old portal, and the old portal is First Aid AMC. If you just write First Aid AMC, this was our old portal. So please do not go into the old portal. The old portal will look like this. So this was our old portal. We no longer use that for our students. And even though we give this notice, but still people go into that portal. The portal that we currently use is this one. So you have to write firstaidamc.com.au and then you'll go into the new portal. The new portal is super fast, super easy. Everything is very, very good there. And in here, if you go to the most popular courses, you'll be able to see the 5 months extensive MCQ course. And if you go to the check information, in here you can read the course summary in details. Everything that you need to know, everything that we have been discussing, it's all in here. So if you go to the cost or course fee option, you will see that there are 4 options in here. In here, there are options where we can't give you CPD certificate because CPD certificate for us to give it to you, we also need some kind of payment from you so that we can provide this kind of service, because otherwise this is not possible for us, or it's not cost effective for us to run a course. And you know that we are the most affordable course in Australia, and all of our mentors are Australian doctors. We don't just do this course for business. A lot of people do that. You will see there are courses who are less duration than us, less effective than us, costing more than 1,000 grand. There are courses who is 2,000, 3,000. But our course, we don't do that. This is not just a business for me or anyone. We make sure that we are IMGs and we can help you to pass this exam where we were also struggling at that same time. So every one of us who are mentors here, we were in your position at some point, and we know how struggling it can be. So it is not just a, don't think that we are doing a business with you, because if we wanted to do business, you will see we would charge you exactly the same like other courses are doing. They are not better than us. Just because they are charging a lot doesn't mean that they are better. They are just charging because they believe that they can charge that to students. So our this option 1 and 2, which is the most affordable one, this we can't give you CPD certificate with it, but you will get a course completion certificate, which will be enough. If you are part of a CPD home, like let's say you are already a member of a CPD home in Australia, then you can add our classes to gather the CPDs. But if you want a CPD certificate after the course, then this option 3 and 4 should be your choice. Now you can ask me that, is CPD important? Not really. CPD is only important for someone who is not working in Australia at the moment. Or not in Australia, sorry. CPD is only important for someone who is not working in their country. So if you are someone who are not currently practicing as a doctor in your country, remember by doctor, it means that you are working in a hospital setting or in a chamber or in a clinic as a doctor, not as a pathologist, not as a lecturer, not as a researcher. Only if you are practicing in one of the hospital or clinic as a doctor, that is counted as recency of practice. So if you are doing that, then you do not need a CPD certificate from us. Then choose option A or option B based on how many months you want the subscription. But if you are in Australia or in your country and you're not working and you're not going to work soon, in that case, CPD is important, because when you are going to register under APRA, then they will ask you that what did you do in that year where you were not working? Then you can say that, yes, this was my reason. I could not work because I was in Australia. There was no way I can work because like I did not pass my exam, but I did finish some course to have continuous professional development. So that's what we call CPD, continuous professional development. Okay? So in every year, so if a person does not work for 1 year, APRA usually wants 50 CPD hours for that year. But our course will provide 150 CPD hours, so 3 times more than what you need for a year. Okay? We talked about the QBank. So QBank, as I say, that we are going to make a bit of a file where you'll get all the QBank related questions with answers. So you really don't need to go and buy any QBank. And there are lots of students who share some of the QBank in different groups anyway. So you really don't need to buy any QBank for your preparation. If I say that if you follow everything that we are going to show you in this 5 months course, you do not need anything else. Okay, that's how much confident we are. So that's basically all about the course. Now I want to answer your queries, and then if we want, we can come back to this again. So let me answer your queries that you have been writing on the chat box, and then you can also ask questions directly if you like. So Sumbal, you asked me that is it necessary to book an exam at weekend? Weekend is not necessary. As we mentioned that yes, it is not a bad idea to book the exam in the last few dates of a month. MQ, so you asked that whether you can pay on 22nd or 23rd June. Yes. So remember, we don't have any specific time that you have to make the payment. You can enroll the course during any time of the course, but your access will end with everyone else. So if you, let's say that you are enrolling 1 month later, doesn't give you 1 month extra access because we are starting the course from 9th of June. So everyone in your batch, their access will end at the same time. So that's why we say that you should join as soon as possible because there is no point of losing these months. There is no point of waiting if you think that this is the right course. If you want to wait for the 2 weeks free session, please do that because that is what we advise for everyone. Because you can always listen to our classes, do the live classes, and see how you feel, and then you can make the payments. Because after the 2 weeks free session, we take 1 week gap before we start the course classes. So you will be fine with that. There is no discount for anyone for the course because the course fee is already minimal course fee. So there is no discount for anything. Yes, Shaika, you asked about whether the exam from April will become different or difficult. Now, this is a myth that we have been hearing from a lot of people who wants to scare you or make money out of scaring you. Exam is always difficult. It's never been super easy. If people say that exam is super easy and you can pass the exam just by solving some recalls, they are just saying things wrong. They are just saying things so that you fail the exam by following them, and then they will laugh at you. And remember that there are people like that. So you will, a lot of time you will see posts like that. I just did last six months recall and I passed my exam. I just did a Q bank and I passed my exam. These are not people who wants to give you the right direction because this is not how things work. If someone doesn't have a proper theory knowledge, by solving a Q bank, by solving some questions, they cannot pass this exam. The exam is not that easy. Okay? So you need a basic structure in your mind. You need a very good theory knowledge. And then if you solve Q bank questions, then yes, you can pass the exam. There is no installment like 120 per month. You get if anyone joined the course during our first 2 week session. Yes, you can pay in installment, but you get 60% payment during your enrollment and 40% in 6 weeks after enrollment. And Anam, this is the only class for today. We are not going to do anything else today. We wanted to have an introduction for AMC. Yes, Assad. So as I mentioned that once you make the full payment, you get access to all our past batch recorded class that will cover the 2026 question solve classes that we have taken so far. It is not a lifetime that EPIC verification will last. Nowadays, they're saying that you have to appear the exam within 12 months of your registration. So once you verify the EPIC account, it is for lifeline. But once you let's say once you register for your exam, then it is the 12 months that you get that you have to appear the exam. Notary verification can take weeks. Sometimes it happens in days, Ananya, but sometimes it can take weeks as well. So you need to just wait. Yes, Assad. So that's the thing that we always mention that AMC is not a recall-based preparation because people who are doing that, they are not passing the exam. Without having a proper theory knowledge, they are not passing. And in your course, and even the course that we are running at the moment, the January batch, we made sure that there has been a lot of change that we have made in we are going to make in your course, and it's already been made in the January batch to to prepare you for the difficult part of the exam. So there was a notification from AMC that from this year, the exam pattern is going to be a bit more difficult because there was a lot of students who were passing the exam. So they just want to slow it down a bit. And again, it might be our fault. But what they're doing, that most likely they're going to make it a little bit difficult, and the marking system can become a bit tricky and complicated. But the thing is that we are making sure that even the most difficult questions you will be able to answer in the exam, because right now from this year we are covering more and more topics, and we always see what topics are important for exam, so we are adding them into the course lecture materials. So nothing is going to be new for you. If you can go through all the discussions with us, there is nothing that's going to be new, because it cannot be. We discuss everything that is important for exam. And Alima, so I hope your question has been answered. For any of you who are going for exam in October and November, we will have a special batch for those 2 months to make sure that you get extra care from our mentors. And we will make sure that you get this kind of care and attention so that you pass your exam. So we always take extra care for October and November because usually that's how our mind works. We prepare for the whole year and we keep October and November for the exam. Most of the students do that. And we always make sure that the October and November student gets a extra benefit from the course. So you will also get that. So please do not get worried. And Utsha, yes, classes are being recorded in the portal. Yeah, current batch recordings will be there, Shubhra. If you miss any class, Tenjin, you will get the recorded. So recorded version will be there throughout the course. So you can access anytime you like. So it's not about that Shumbal or Sultan. So access depends on how many months access you have subscribed for. So the June batch, the minimum subscription you will get is 10 months. So yes, definitely like everyone will get access till next year. If you need more than that, you can also subscribe for 15 months. So we have a huge access. Again, the same thing, no course gives access like ours. So with the most affordable cost, we provide the highest number of classes, highest number of course access duration, and also the highest number of passing students. Okay? Amlan, so you have to be working as a doctor. Without working as a doctor, so if you're working in Bupa or any other healthcare as a doctor, that will be counted as a recency, but nothing else is going to be counted. And Khalid, if you go to AMC website has got all the necessary details for each month. So let me show you the AMC website a little bit so that you can get yourself acquainted with that. So this is the Australian Medical Council, AMC, the main website. And if you go to the International Medical Graduate and click on MCQ exam, everything is written in here. Read the AMC exam specification. So everything is here. If you read it, it will be really helpful. You can see the examination events. So this is where all the dates are there. So for November, so you can see in November, we have got from the event date is from 16th November to 21st November. These are the exam dates. And the scheduling will close for 16th November. So all the November exam, the scheduling will close on
Hi, doctor.
26th of October. Okay. So on 26th of October, that's the last time that you can register for November exam. So you can see all these exam dates in the website.
Here, doctor.
Yeah. Who is that?
Can
I
I
am.
get to know when the slots of next year will be available for booking my exam?
That's not given in the website, but if you see this year, that will be more or less the similar dates. So you can see that for March exam, the
As I have
slots.
already paid exam fee, but there is no slot available till November in Pakistan. So I'm planning to reschedule my exam on like Feb, March, whichever seat is available. So how can I get to know when the slots will be available?
That you can't know yet. So they haven't opened that scheduling yet. So that will be usually at the end of the year when you'll be able to get those. Or the other way is that you can send an email to AMC and tell them that you want to reschedule for next year and whether they can give you that a specific exam schedule because no one knows apart from them. When will be the next first aid course after this June course? That will be next year, January. So we only take 2 courses in a year, January and June.
Hello, sir.
Yeah.
I have a question. Like, if I'm not finding any seat later in the weekend and I found like seat on Tuesday, it's good to go with the November date or need to book in a Feb, wait for the Feb
No,
seats? What you
no,
suggest?
go for November. If you are prepared, then just for the like initial dates, you don't really need to change the exam because the as long as you are waiting, you are also struggling with more and more questions. You're struggling with extending the preparation. If you become fully prepared, it doesn't really matter if you go for exam on the first day. It's okay. You don't need to change for that.
And sir, recalls are not included in your session. For example, if you're taking the exam week recall, for example, if I'm having one day or some person's having 4 or 5 days, so they have to subscribe another like course. It's not included in the same course.
It's not included in the same course because it takes at least 10 to 12 hours per day to take something like that. So it's not, we can't do that as part of the course that we are taking. It is almost impossible to run a course like that. And it's a lot of effort. You must understand that when we solve any questions, the mentor needs to prepare for them, and it's just like back-to-back questions. And that is something that even if you need to go for anywhere, you will be paying a lot of amount to do those. So that cannot be added as part of the course. But we do solve questions every month anyway. Okay.
And sir, one more question is, like in your course, you are providing some notes.
Yes.
Okay,
All the
and these
notes
are
are
enough.
provided.
Okay, and these are enough. We need not to read anything extra and any subscribe any QBank apart from you, as you have told eMedici, right?
Yeah. Yeah. So normally we don't advise anything that you need to buy apart from the course. Now, if you tell me that you
Okay.
don't need to read anything else, that is wrong. Every student needs to read a bit of a guideline time to time. Like, let's say that we will discuss
Mm-hmm.
almost everything that is needed, but time to time, there will be new questions coming for the first time. Or let's say that during the class, we can say that this is a good, like, let's say we discussed hypothyroidism in a class. And then we can
Mm-hmm.
say that on RACGP, there is a guideline which you should read. That is something that, yes, every student needs to read a bit of a guideline time to time, but most of the important topics will be covered.
Mm-hmm. Like guidelines will be written in your notes, right?
Yes.
Hello, sir.
So,
Am I audible?
yeah, Eric?
Sir, I just need to discuss about recording classes. I contacted one of your team members, and I just mentioned that if I pay the full payment of the planned course that's going to be starting from June, can I get recording classes uh, before starting the course?
No,
And the
you
answer was
can't.
no.
No, you can't. So the course start from 9th of June. All the
Mhm.
material access will start from 1st of June. So from 1st of June, you will be able to get access to everything if you pay the full amount. So that's
From
how
1st
it
of June.
is. Yeah.
Okay. And so the second question is that uh, the ongoing month is June. The recall classes, the recalls we are seeing on social media, are these recalls included in our new session?
Which one you are saying?
The ongoing recalls, the ongoing exams.
Yeah, all those, though that's what we call as like question solve classes. So question solve classes are those questions that we discuss monthly. It is included in your course.
Okay, ठीक. Thank you, sir.
Thank you. There is no last date for enrolling, Cinda, so you can enroll at any time. But it is better to enroll when the course access is given to students because it means that you can start your preparation right away.
Sir, can we get first 2 week classes without enrollment?
Yes, you don't need to enroll for first 2 week sessions. Those are free for everyone.
Okay, the link will be shared on your website or
Yeah,
where?
so the link will be shared on our First Aid AMC MCQ Facebook group. So in the Facebook group, so I'm going to just put this link over here on your chat box, and you can see the link of our Facebook group. So that's where we will add all the schedules. And Tahsin, how to make the payment? Good question. So if you come to the course website, so it's all through the website. So if you come to the website and click on register now, they will take you through the course payment. So the software will ask you some details. They might ask for a one-time password and all. So just to verify your email, and then it will take you through everything. Then you can make the payment through the website. One other thing that there are some countries where those countries do not allow paying $600 at a time. If that is your country, then we will be able to send separate invoice to you, and you need to pay all the invoices, and then you can pay all like $600 in that way if your country does not provide that. So I know a few countries, especially in Asian countries, you cannot pay more than 300 or 400 at a time. So if that is the case, and if you say that yes, my country don't do that, or my bank is restricting that, then we send invoices, separate invoices like 200, 200, 200 for 600 or something like that. And you can pay all the invoices in that way. And then we can give you access in the portal. So that is something that we don't like to do, but again, there is no other way. We are always there to help you if you need.
So the accessibility of the study material is, sir, device specific, or I can use it through my mobile also, or sometimes iPad also, sir?
It is device specific.
Okay.
सर डॉक्टर फ्री करवानी है तो आईसीयू में हाँ
Sorry?
I had a question. Can I please ask?
Yes, Mubir, you can ask.
Okay, the thing is, nearly a bit more than 2 years back, I made an Epic account, and informations were given and verification were done. It was in ECFMG Epic. So, but somehow, due to some reason, I couldn't attend or book any exam date. So the thing is, recently I've got a chance to go for it again, but that verification and candidate number is not valid anymore. It's saying that, or it has moved to my in health.
My in health, yeah.
Right. So, do I have to go for it again, or the complete process of verification and online notary blah blah blah?
The thing is that a lot of students who has done the EPIC long ago, they are doing it again. So if your one has got expired, then yes, you will need to do it again. Because they have changed it to new one, that Intel Health. Intel, basically.
My in health, right. Thank you.
Hello, sir.
Yeah.
Sir, I'm from Pakistan, and can we have some Pakistan account for transaction? Because international transaction adds some extra charges.
We
Is it
can't do that.
possible?
Sorry. No, Eric, because it's all about like it happens online, and it is not possible for anyone. Like it's the same thing will happen when you'll be paying for the AMC. You will always need to pay in the Australian dollar.
Okay, thank you, sir. And next question is, sir, my exam is just in October. I'm just concerned about my exam dates. If recordings are available on the from the 1st of June, how should the ideal approach recording plus the ongoing session should be for candidate of October?
Yes, good question, Eric. So we will go through that in the orientation class anyway. We'll discuss those things. But in a nutshell, it should be like we will give you a kind of like a schedule or overview of the monthly classes that we are going to take. So you'll have an idea that this month, that is the topics that we are going to discuss. And you will also know what classes we are going to take in September, October, or even August, last 3 months before your exam. Those classes you should start going through from the portal, the past batch recordings, so that you don't need to wait for our classes. The theory classes are going to be more or less similar. We add new things based on the exam questions every time, but it will be enough for your preparation. So you should start listening to those months' recordings and also join the live classes. So live class will cover the first 2-month classes, and you will be covering the last 3 months by yourself through the portal. In that way, if you can do that, in that way, your exam time preparation is going to be 2 to 3 months. And then you'll be doing all the recent question solve classes with us in the live class. Plus, in the portal, you will get 6-month past recalls as well. So those you will be covering by yourself. So it will be a combination of live classes plus the past batch recordings. Together, you can finish everything that you need within few months. I know it's a bit complex, might not making a lot of sense, but that's how it's gonna be.
Okay, so I understand that if we join a regular session, then we should listen the recordings of a previous session from the end.
Yes, that's right. Because the end month class, most likely you will not be able to take because your exam will be very near. You can take it, but my advice will be to finish those topics because you should do those topics ASAP because your exam is near.
Okay, answer last question, please. Can we add CPD course just after the our regular course is finished if we join the first is A option, option 1?
Option 1, you can add these classes in any CPD home. So if you are part of any other CPD home in Australia, like RACGP, Akram, lots of other homes are there, then yes, you can add our classes and can get CPD points from those providers.
Thank you, sir.
Okay.
Sir, I have a question.
Yes.
So as you said that you're gonna take care of the October and November candidates. So what extra care you will give? Can you please explain it?
So those two, because we have one that the course for October and November, the course is going to be very near because we are finishing everything by the end of October. So what will happen that October students and November students, we are going to make sure that they are together in a portal, in a group, and they will be doing more question solves with the mentor.
Mhm.
Hello, sir. Can I ask a question?
Yes, Sajid?
Yeah, I made my AMC account in 2023, and I recently booked my exam in November. And now it's showing it's showing in my dashboard account. There's an AMC number over there, and it's like showing my Intel ID number as well. And the status is showing the schedule for AMC examination. Do I need to do anything regarding my verification?
No, you have got everything. Was your MBBS certificate verified by the notary camp? It should be before you got your candidate number.
No, they just give me after the verification, but I
Yes,
did it before, like 2023 back.
that's okay because it has been verified already. You don't need to do anything. You have candidate number. With the candidate number, you can register for the exam. Okay. And also, like, I think you have already registered for exam because it's showing a schedule for exam. So you don't need to do anything else.
Okay. And another thing I just want to know, the previous passport I used during the verification process, it is now expired. I got a new passport. So do I need to submit during examination the old one or the new one?
The best way, because these kind of things always causes trouble, best way is to contact AMC and tell them that that is what happened. And what normally can happen that they can ask you to update your passport detail on the EPIC. Because the EPIC passport detail will be, that's how they can verify you during your exam. So
Yeah, I already talked with the Epic customer service, which is
good.
in USA.
Mhm.
And they said that they don't share anything with the AMC regarding this verification process. But still, for my side, I update my new passport in the document evidence in the AMC portal.
That's all
But
that you need.
the Epic verification, they said they don't share anything regarding candidates' details with AMC. So can I go through like this way?
Yeah, that's totally fine. Sajid, so the main thing is that you have uploaded the documents on the portal, and
Yep.
that will be enough for this. Nothing much you need to do. If you want to be extra cautious and extra sure, you can even contact with AMC, like the AMC people. They might be able to say that, yes, So you can say that, well, this is the case. My passport has got expired and I have uploaded my previous passport on the Epic. Do I need to add anything extra in the Epic account? Most of the time they will say, we don't have anything to do with it, so you are fine. But it's not a bad idea to have it as a document. So send an email
Like
to them.
I already contact with the Epic people. They said the one I gave them for the verification, they don't need anything else because they have already all those documents regarding my details. And I said that the previous passport is like get expired. Do I need to give you the new one? They said no.
That's fine.
And I upload the new one in the AMC account. So the during examination, it's like different thing,
Yeah.
They conduct the examination by Pearson view. So they will actually like
They will actually
like
match the document that you have uploaded recently. That will be fine.
but in the portal it's showing the older one, like the older thing. When I click my Intel account, it's showing the attested old passport.
It should be fine because the Epic already mentioned to you that you don't need to change anything there. It's okay.
Okay, thank you, doctor. Thank you so much.
Hello,
Thank
hello, sir. I have a question.
you. Yes, Dr. Fatima.
On which device we can get access of the portal? Like, can we access it on the laptop or tablet? As you said earlier, that it is the access is device specific.
Yeah, you can use it in any device, like any one device. Laptop is the
Okay.
best way to use the portal. I always advise that because it's bigger screen, it's the best way to learn.
Okay. Thank you.
Doctor, I have another question. Like I am your ex-student. I did a 5-month course back in 2023. So now I want to join in new course. Do you recommend me to join the theory course again, or I can join the recall session?
Sajid, 2023 is a long ago. The MCQ preparation that we are doing at the
24.
moment,
Yeah.
2024, for 2
Yeah.
years. Yeah, still I would recommend that because we changed a lot. The last 1 year, the course has got a massive update because the exam has got a bit difficult and they are making it a bit difficult this year as well. So you will find out there is a huge difference between the 2024 course and this year course. So my recommendation is yes, you should go to the full course. If you did it last year, I would say no need.
Thank you, doctor.
Thank
Hello,
Hello.
sir.
you. Yes, Eric?
Sir, I just need to know about. I am currently now working a doctor from 1.5 year, and previous 1 year was I was at home due to some reason. Is it advisable for me to join CPD course or should I choose option A? If you can suggest, please.
If you are not, so Eric, were you working for the last 1 year or you're not?
From 1.5 year, from last 1.5 year, I'm working as a doctor in a hospital.
That's fine. You don't need a CPD. You have the recency.
Okay. Thank you, sir.
Thank you.
Hi, sir.
Sorry.
Cinda?
Okay, I have a
Yeah.
question.
Hello, sir.
Yeah.
I wanted to know that actually I only have received my provisional degree certificate as of now, and I will only receive the final degree certificate by October, November. So how long does the EPIC verification take for me? So when can I attend the exam or apply for the exam?
You need to provide them the MBBS certificate. Without the certificate, they will not allow you to go for the exam. And there is no specific time. Some students say that it happens within 48 hours. Some says it even takes a month. So there is no specific time that I can say to you, unfortunately, Cinda. I think like you should work towards
Yeah.
next year exam.
February. Okay. So, and regarding the CPD points, so as of now, I just finished my internship a month back. Now I'm planning on working maybe after 2 months. So then I do not need to take the CPD course, right? Because I'm planning on working after like 2 months till
That's
I
fine.
take the exam.
That's fine. If you are working, like if you work, let's say that normally we say at least in a year, if you're working 12 weeks full time, that also becomes a part of recency. So if you're working 3 months in a year, that also becomes like you don't need a CPD for that.
Okay, thank you. What about you told about the special recall classes for the October, November attending exam. But for the February, is there anything available if we are
So,
attending on in Feb?
so then like you can also add into our exam week recall batch. Like we will be doing that exam week recall sessions. That one you can get added.
Okay, this portal we will get access if we join for the 5 months course for 5 months exact, right? And
No,
if we
you
join
get
for the 10 months, then
there is not like that. So it's like you minimum access is 10 months. So 5 months you get it in during the course and another extra 5 months after the course. So 10 months you get minimum. Okay.
okay,
And
okay,
some people can add like 15 months total as well.
okay. Thank you so much.
Okay.
Hi, sir.
Ibrahim, yeah.
Okay. Hello, sir. Thanks so much for the information, and it's actually been a whole lot. I actually learned a lot. I'm
That's
actually
fine.
a new member. I think I paid for the course today. So
Okay.
I got a mail that said I could only attend the portal or use the portal on just one device. So I don't know, in
Yes.
a situation whereby I need to navigate between my phone and my laptop, because I'm using my laptop for the portal, I intend to use my laptop. So I don't know if there's provision to use a mobile device together with a laptop or just stick to one.
You stick to one.
Okay, okay. And then okay, I was told within a day to two, I should be able to get access to the portal from the mail I got. But I don't know. I think during the course of the whole orientation today, someone mentioned I think till January till June 1st. So I don't know, is it till June 1st before I'm able to access the portal,
It is.
or I can
So
access it before?
we add everyone, like we add them
Okay,
everyone into the portal, but you will not be able to see any materials there until 1st of June.
okay, okay, okay. Thank you very much, sir.
Thank you.
Sir, Assalamu alaikum, sir. I have one question.
Dr. Shah, I have a question.
The first one and then Kandil.
Okay, sir. Myself, I'm from Pakistan, and I have an my Intel account, but and notary camp has also been done, but I haven't verified my MBBS certificate, and I have also pending work at AMC portfolio to open. I have missed this session's first 30 minutes, so I need to learn that what would be the best possible way that should I go for AMC portfolio opening first, then Epic verification, or else Epic verification of my MBBS certificate, then followed by AMC
So
portfolio opening?
it should be side by side. So you apply for, so you create an Epic account, and then you also apply for the other one. So it's a more or less the same thing. So in the Intel Health, you will be uploading your MBBS certificate, and they will verify that over the notary cam.
Okay, sir.
Okay, and also what we will do, so we haven't discussed anything about the Epic. So we will, once we finish the 2 weeks free session, we will help you with the Epic account things. There is a lot of questions about Epic account, and it changes a lot. So we will help you with that. So don't worry. And in our course, there will be a huge amount of students. And those students also do this Epic verification every day. So they will also help you if there is any kind of weird issues that you have. Everyone, like every batch, we see so many weird issues with this Intel Health. They don't make it easy, I know, but you will get help. So you will not be left alone with these kind of things.
Sir, and another question is, if I enrolled on first weeks of June before commencing 9th June, then and full payment on registration, then
Yep.
can I get the access of the live videos on recorded version in your portal?
Yes, you will. You will get the past batch recorded sessions there.
But if I pay 60% on, I go for enrollment, I mean, first
First
60%
installment.
on registration, and after 6 weeks, within 6 weeks, 40%, then I should only be avail the live classes, not
Yes.
the recording.
That's right. Yes. So if you pay the installment, you will only get the live sessions in the portal. You will not get access to the last batch recordings. Once you make the full payment, you get the full access.
Thank you.
Thank you.
Hello, good
Hi,
evening, sir.
sir. I have a question. I have a question.
There was another person, Kandil, I can't remember the name.
Hi, Dr. Harshan.
Yes, Kandil, yeah.
So I want to ask, is 6 months enough for the preparation?
Yep, enough, more than enough. So we say that 6 months, if you have a lot of time, like you can give maximum time for studying. 8 months if you can't give a lot of time. So 6 to 8 months is the preparation time.
Like if I take this course and then give exam at the end of November, I will be my preparation will be sufficient enough?
More than enough.
Okay, thank you.
Sir, I have a question that in eMedicine, I saw a lot of topics which you didn't mention in your course, and they are having a lot of questions. So it is necessary to finish all the eMedicine questions?
That's so right. I'm not sure, Shumbal, did you do this course or any other course? Which course you are doing?
No, I'm talking about, as you said, like eMedicine is a Q bank which is nominated by AMC. So I'm just asking, like there are a lot more topics which are mentioned in the eMedicine, but you didn't mention your course as I was going through, and there are a lot more questions. So is it necessary to finish eMedicine side by side? It's important to do all the questions.
First question, Shumbal, are you already doing our course or you haven't done our course yet?
No, I'm not. I didn't done yet. It's a class I'm taking. I'm planning to take in June. Yeah.
Yeah, so you would not know that if we have like taken so the topics in eMedicine, I'm sure we discussed like almost most of them in the course.
Okay.
And then the other topics, like let's say a few things that can be new in the eMedicine, that's also we are incorporating in your course. So you'll be fine with that. You don't need a eMedicine subscription, because what we are planning in your batch is bringing those questions in a PDF file and then giving it to you so that you can also read it, and also incorporating that into the course materials.
Okay, so she will include all. And the second question is, as you said that there are mock tests, which are like at the end of each chapter, for example, after cardiology, that we are taking a mock test. So this mock test is same as like the computer adaptive test as we are taking. It's same on the exam pattern that you will give us feedback.
Yes, it's the same pattern the exam is going to be. The only thing that is different is we cannot make the software thinking like how AMC does, like how they do, like one question easy, second question difficult. That is what we can't do. But apart from that, everything will be exam wise. The feedback, the pattern of questions, explanations, everything is same.
Like the difficulty level is the same, like as in the real paper or in the AMC?
Difficulty level will be more than exam.
Okay, so if someone is achieving a good score, a good percentage in your marks, then it's good, like the person should be confident enough, right?
Yes. We say that if you get 60% mark in our mock, you can appear for the exam.
Okay. Thank you, sir.
I have a question,
Doctor.
Doctor.
Grace, yes.
So my question is, can you give me clarity on the recalls and exam week session? Is it different from the course?
No,
I
it's
got a
not
bit
different.
confused.
Good question, Grace. So the question solved classes that you are going to get as part of the course, So you get 40 sessions of question solve classes as a live session. Every month, we do solve questions as part of the course. But the exam week questions are like, let's say that we'll be solving questions for 1 or 2 days just during the time when the exam is happening. That will be like fast forward question solve class. Like entire day, 8 hours, 10 hours we'll be doing session, which we can't do for the course enrollment part people. But as part of the course, those same questions will be discussed in your batch as well, but throughout that month. So that's the only difference. So exam week, it will be maybe 1 or 2 days, 8 to 10 hours session. But the similar questions we'll be discussing in your course in that month as well. Okay.
Do you mean we can be a part of that session, like the exam week session?
Only who is going for the exam on that month.
Okay. But the
Okay.
question will be solved on
Yes.
the exam week, exam course, like during the 5 months exam.
Yes. Yeah. So those questions that we are
Okay.
solving in the exam week days, that will be solved in your batch as well eventually. It's just like for people who are appearing exam on that week, for them we are doing this like 8 hour, 10 hour session.
But doctor, like if I am planning to take an exam within 3 months, and if I want to finish the whole thing before the course ended, is there anything that you do to help me, like other than the recorded one and other things?
What do
Like
you
to
mean,
get
Grace?
especially to get the exam week questions, because if I am intended to take the exam within 3 months before the course ended.
So you will be able to enroll in that month when your exam is going to be. So we normally allow only the exam students in that batch. That's how we can make it solely for the exam students. But if it is like let's say that if you want to enroll into that exam week sessions, it is really not necessary because you will be paying extra, which is not needed because you will be getting those questions in your batch anyway. So there will be no point of doing that. That's what I'm trying to say, Grace. You can enroll if you really want, but you will be paying extra, which you really don't need to, because we'll be solving those exact same questions in your course.
All right. Thank you so much.
And sir, for
Hello,
the
doctor. I have a question.
Yeah, Malik.
Oh,
Malik.
oh, sorry. Thank you so much, Dada. Sorry. I'm just observing this chat. Sorry, my bad. I'm supposed to be joining the clinical, course. But I think I will ask the very common
Assalamualaikum.
questions. Sorry. Yeah. Can I ask you one question? Sorry, doctor,
Yes.
if you don't
Yes,
mind.
Malik. It's okay.
Yes, thank you so much. So if I join the clinical course, is there any like theoretical information on the portal, or it's just a recording of the our online classes? Thank you, doctor.
Malik, are you talking about AMC clinical course that we provide?
Yes, you're right, doctor. So that would be, the same anyway. So yeah.
Yeah.
Any other course?
Sir,
Yeah.
Sorry, Rumi, please.
Assalamualaikum.
Rumi, please wait a little bit. We're talking with Malik at the moment. Malik, so AMC clinical course is totally different from MCQ course. We will have a just similar like this. We will have a trial class in a week, which is 23rd of May. I advise you to join that trial class where we will discuss each and everything about AMC clinical preparation. We do have similar kind of clinical course as well. And it's not a recorded session only, it's also the same like live sessions plus previous batch recorded class, which you can also learn from here if you have any questions. So this is where our clinical course details are. So you can learn about everything over there, or join our 23rd May trial class. You will learn each and everything that you want to know.
Thank you, Dada. Appreciate it.
Thank you.
Sorry.
Yeah.
Hello,
Yes,
sir. Assalamualaikum.
Yes. Some, yeah.
Sir, can I apply for a job after passing MC part 1, or I have to pass part 2 also
For job?
for applying the job in Australia?
Yeah. So for job, Rumi, you need to only pass part 1 and English, and then you can appear for the job or apply for the job. It is easy to get a job after part 2, but you will be eligible to apply after part 1.
Okay, sir. Thank you, sir.
Oh, hello, doctor. I have a question.
Yes, Sajini?
Yeah, so my question is regarding EPIC verification. So during my EPIC verification, I mistakenly listed my medical college name instead of the university as the issuing institution. And in case of my case status, it is shown that my certificates are sent for verification. What should I do now? Should I contact EPIC or I should wait?
So your certificate has been already sent for verification. Is that what you're
Yeah,
saying?
but already sent, but my medical college still not received thus for verification.
How many
I missed
weeks has been?
um uh 10 sorry, maybe 7 days. 7 days. Yeah, 7 days.
That's not enough, Sajnain. It takes some time. So wait a little bit.
Okay.
Wait for 3 more weeks. If still they haven't received anything, then you can contact with them.
But I made a mistake. Instead of my university name, I put my medical college name in the issuing institution. So regarding this, should I contact with EPIC or not?
I think you should contact, because
Oh,
sometimes
okay.
it can be a bit tricky. So it's better to contact with them anyway.
Oh, okay. Thank you.
Thank you.
I have a question, sir.
Yes, Ramesh?
My exam is on 19 November, and I'll be starting from 9 June with you from zero. So you think I have enough time to prepare if I'm not doing any job beyond that?
Ramesh, sorry, I missed your last question. What did you ask?
Sir, I am saying my exam is on 19th November, and I'll be preparing with you from scratch from 9th June, and I'll not be doing any job. So you
Yes.
think I have enough time to prepare, or I should reschedule my date?
No, you will have enough time to prepare. Right now, you don't do anything. When you start preparation, you will understand that whether you are prepared or not. You still will have time to withdraw or change or reschedule. So in couple of months, you will be able to make a better decision. If you see that your preparation is not going really good, or you think that it's not going to be like perfect by November, then you reschedule. Right now, you just keep it as it is.
Okay, thank you.
Thank
you. Hi, sir.
Yes.
Sir, it's heard that many of the guidelines have been changed in a recent month. If we join the session on 9 June and got access of the recorded classes, is it adjustable with the recent changes, being a candidate of October exam?
Yes, everything that changes. So all the recent guidelines, I always make sure that you get the most updated guidelines. So every batch is different from the next batch. So the current batch students will not, if they join the new batch, they will find there has been always some changes. So we always change based on the guidelines. We add things based on the important questions that's coming in exam. So it will be always added. Okay, so don't worry about that. All right, guys, I think we will still have a lot of time to meet and answer your questions. So I'll just finish with few questions that you have written on the chat box. So I have a question. So for Neela, I have a question. I'm working. I can't take my laptop. It's convenient for me. Yes, you can. So you can use Portal on a single device. So you can either use your phone. Phone is also perfect. Our Portal works perfectly on phone. If phone is easy for you, you can use that, or the laptop. Doesn't matter, but it is only one specific device. No, Mithila, once you enroll into a course, you cannot upgrade the course later. Because our software is designed in that way that they will give you the access according to the subscription payment that you are doing. So our next class is going to start from 9th of June. So 9th June, we will have our first trial class. Okay, and we will not discuss about AMC MCQ. We will go into the topics on that class. You will get the full schedule of this 2 weeks free session that's going to start from 9th of June. Please keep an eye on the Facebook group where we will add everything. Okay, I hope you liked the session. I hope it made a little bit of sense, but definitely there is a lot to learn. And throughout this course, throughout the next few sessions, you will learn more and more. Okay, I'm sorry if I was not able to answer a few of your questions, but I will definitely answer that again if you ask. Thanks everyone. Have a good night. Malik, just wondering for the access to the course material for 10 months, do we get the notes, guideline, or just the you get the notes, definitely. You will get notes, guidelines, you get the recording, so everything will be there. Noor, so everyone will get access from 1st of June. So yes, once you get access to the portal, you will get the previous batch recorded lectures, but only if you make the full payment. Okay, if you make installment payment, then you will not get access to the previous batch initially. Same time, it's 7:30 p.m. Sydney time. CPD are not needed for exam. It's for applying job later on. Tasneem, you don't need any other experience. Please make sure that you have a recency of practice. So if you're doing internship during your exam preparation, like you'll be preparing for part 1, part 2, keep doing some kind of work as a doctor. So you should have your recency, and that will be important for later on when you're applying for a job. Not really, Tasneem. It depends on. So right now, please do not choose any exam date yet. If you want, you can keep in your mind that you are preparing for November exam. There is no batch which is a special. Every student is a special to us. So every student will get the necessary things that is needed to pass the exam. Okay, so do not think that it is the October and November batch who are special. Everyone is special to us. But October, November, because there is a lot of students appearing, we will just help them a little bit more extra. But doesn't mean that someone appearing for September, July, or February will not get that care. They always get care. If anyone struggle with anything, we will help them in every possible way. So you do not need to change your plan for that purpose. You can keep in your mind that yes, November is going to be your exam, and then see how you go over the next 2 months. If you feel that you are not ready, then go for February exam, because it is better to be prepared and then appear the exam. Okay, because if you fail MCQ, it's not a good thing, because people usually should not fail MCQ. With the course that we are giving you, you are supposed to pass. And if you're failing, means that you are not well prepared and you did not give enough time to pass the exam. That's the only reason. So be prepared and then appear the exam. It's not a hurry, it's not a competition, and it's not something that is based on November, October. Everyone, like our candidate, pass equally in every month. Okay? Yes, there is no exam in December or January. That's right. You don't really need anyone in your country to help you open the EPIC. It's quite nice and easy. We will help you with that. Don't worry. No, you don't get an individual CPD number, but if you register for the CPD course certificate, you get a CPD course certificate, not a CPD number. And you get one device for the portal. Clinical gap if you're not working as a doctor in your country or anywhere. So clinical gap means when you don't work as a doctor at the moment. And Fatima or anyone who is wondering, you can only use one device for the portal. It is to ensure that people who are paying for the course, they are the only one who is accessing the course. We see a lot of scammers, a lot of illegal people who doesn't pay for this. So you are definitely paying for a course and you really don't want someone else getting access to the materials that we are sharing with you. And I'm sure all of you agree. And this is the only way we can make sure of that, to ensure the course standard, to ensure we can afford giving you a course with an affordable price. This is the way that we can do it. Okay? Yes, clinical gap is a concern only when you are applying for a job, not for exam. You cannot download the notes. Yes, access is there until so for 10 months, you get access for 10 months. Vadna. And Eric, I think I already mentioned. So you should, if you're appearing the October exam, then you should go into the recorded version. So in our last month of the course, we normally, if I'm not wrong, we normally focus on surgery, orthopedics, those ones. So you can start watching the surgery and orthopedics class. That will be one. And also you can also go into gynae and obstetrics. These ones will be the last month's course classes. You cannot download recording. The problem is that if you don't work, you need a CPD certificate to cover that month, cover that year. So basically, if you're not working at all in a year, then the only way you can explain to APRA that you did not work, that yes, you did some CPD course. The thing is that even though if you don't do like let's say you have 1 year gap, the whole year, this year you have gap, and you are not actually applying job this year, you will be applying job most likely in the next 2 years. So even at that time, if you can show some CPD course, that will be also enough. But when we prepare you not only for the exam, we prepare you for the life ahead, which means being a doctor in Australia. The best and most smooth way to do this is if you have a clinical gap, like let's say 12 months of gap, then for that 12 month, you should have a CPD course, at least 50 CPD hours in that year. That's going to be much more smooth later on when you are applying for a job. Doesn't mean that you will not be able to apply for a job if you don't have a CPD. You can. There will be other ways, but it's going to be a bit complex. All right, guys, I think we are way out of time tonight, and we'll discuss more we have two weeks of free sessions, so I'll be answering more questions as we go. Okay. Thanks everyone for joining and active participation. It was really, really lovely. Thank you. Have a good night. Bye.